We all choose to go to meetings for a variety of reasons. The quality of the ESMIS meeting is continuing to improve, and that with that continued improvement, I think the value proposition to the attendees will continue to increase.
ESMIS is very unique in the fact that it's focused on teaching surgeons not only just from a theoretical perspective, from lectures and presentations and scientific exhibits, but it's really also focused on teaching surgeons how to perform minimally invasive surgery in a very safe and effective manner.
It's a wonderful venue to sort of get introduced once again to a cadaver lab and come in and talk to the experts that can teach you the techniques that maybe you've had some questions about, maybe learn a little bit more about the indications, understand sort of the post-operative protocols, but also get introduced to the scientific sessions and talk to the experts that are involved in their specific areas of MIS and learn about the current level of data that supports minimally invasive techniques.
We put on 2 great cadaver courses this year, one Essentials and one Advanced course for those who were more familiar with the techniques. Every one of these talks you'll hear there's a steep learning curve, and you don't want that learning curve to occur with your patients. You want it to occur in a cadaver lab.
Many societies are grown so large that the members don't have the opportunity to impact the society. We're not in the thousands, we're in the hundreds. And if you want to get involved, you have a chance to make a real impact, not just on your patients, but on advocacy and research.
Since SMISS is I would say, peer-reviewed society, every technique, every paper that is presented go through a rigorous process of selection. So when a paper of a lecture is presented at SMISS, it means like you are dealing with a technique that is already reproducible, efficient, and safe.
I think putting it out on the web, putting it out on the internet for people to see that the societies such as these are publishing scientific outcome data. So it takes it away from the realm of gimmickry and internet advertising. I think this becomes a truly scientific meeting with true scientific value.
It's really exciting. We have 16 different countries represented with 200 surgeons here this year. It is becoming an international society, and getting that influx of new ideas is tremendously important.
We had a session on cervical, and we heard minimally invasive posterior cervical from who? From Asia, of course. They have much more experience than we have here in the Americas, including South America. It's a specific example that other countries could add experience to SMIS.
What can you do? I think it's very simple. Get involved. We have terrific people, and what the society can do is create a forum in which we can collaborate, because through collaboration we can really grow this into an international success.
In addition to the meetings, we developed a core curriculum, and that's a program where we have a standardized way or a consensus by which we try to impart information on new technologies to our growing membership. In addition, we just launched the prospective registry, where we will be able to keep track of all the patients that we operate on, so that we can build up a database of clinical information, and that information we can use to answer questions that are posed to us very frequently that oftentimes we can't answer in a robust way, whereas in 5 years we may have thousands of patients in a registry.
At this meeting, there's so much data to verify what we always thought and knew, was the fact that this approach is the right thing to do for our patients. And that's one of the main tenets of medicine. You know, first, do no harm. If we know that there is a better way of treating our patients, we're obligated to actually learn how to do that and to treat our patients in that manner.